Hi, my name is Sean. Just wanted to share with you some items that I have deemed hysterectomy must-haves. And just to let you know, I had the abdominal hysterectomy with a horizontal incision. So some of the items that I share might be more specific to that type of surgery as opposed to the laparoscopic, robotic, or vaginal surgeries. So, and also the items that I'm going to share, they're not going to be in any specific order, but I would like to start off by telling you that one of the must-haves is a caretaker. You must have somebody that is going to be able to assist you through your recovery process, specifically for those 3 to 4 weeks, because you will not be able to do some of the tasks that you're normally able to do on a day-to-day basis without some sort of assistance. And obviously you won't be able to ambulate how you normally would because of this type of surgery. So I just wanted to start off with that and let you know that you definitely are going to need a caretaker. When I was in the hospital, I had the surgery, stayed there that night, and then 2 more nights after that. And one of the items that I had on that they gave me were mesh panties. And these were comfortable because of that incision. You definitely don't want anything that's restrictive as it relates to undergarments, because you don't want anything creating any pressure. Don't want anything to be tight in that area because it's going to cause more discomfort, and you're already going to be experiencing pain and discomfort. So anything that you can introduce in your recovery process to make you as comfortable as possible, I definitely would recommend that, and that's why I'm sharing these with you. When I got home, I ordered some of these on Amazon just to have extra. I think they came in a pack of 6, and they are reusable. You can wash them and you can hang them to dry, so you definitely get your bang for your buck on these. And with that being said, another item that you'll need are panty liners, because your body will definitely be processing some stuff. And to give you an example of that, I did experience spotting after the surgery, close to 2 weeks. So definitely needed panty liners, and the adhesive on the panty liners will stick to the mesh panties, and they stay pretty stationary, so you don't have to worry about them moving around and creating any more discomfort than you probably will already be experiencing with that. Also, I have, as far as apparel, I wore pajamas for 4 weeks. I think the first time that I wore my regular clothes were on my first post-operative appointment, and that was 4 weeks after I had the surgery. And I have a lot of pajama sets, and one of the things that I had to do in some of the pajamas was cut a slit right here, because the elastic was too tight around my stomach. So that was definitely uncomfortable. So I had to cut little slits here, but wanted to be comfortable and presentable because I had people to come over and visit, for, just well wishes or drop something off or just keep me company. So one of the things that you can consider doing is buying matching pajamas. Serves a dual purpose, keeps you comfortable, and also helps you to, allows you to stay decent when you have company over. So matching pajamas was one of my go-tos. But sometimes my body temperature would go up and down. Sometimes I would be hot, sometimes I would be cold. And I would ask my mom to just that night or that day just put on a nightgown. I would just put on a nightgown and, nothing fancy, nightgown, night shirt, just to kind of keep you cool. And you can, have some freedom there, and you don't have to worry about anything being putting any pressure around that incision. And so that's another item there. And also socks, because sometimes I would be cold and I would want socks on my feet, but I wanted to have socks that were loose enough to where I can just kick them off with my feet, just in case I started to get hot, and then I wouldn't have to call my mom in to take my socks off. I can just do it myself, because again, you won't have the same mobility in the beginning stages, so as you're used to having. So definitely, that's something. I ordered this on Amazon prior to me having the surgery, and I just typed in hysterectomy pillow, and you can actually, when you're discharged, you have to put that seatbelt on, obviously. And the last thing you want is that waist part of the seatbelt putting any pressure around your stomach. So you actually put the seatbelt in these little slots here, Velcro, and you just put it through there, and this is how it's gonna rest on your belly. And you can also put your hand here, give you some stability, create a sense of security, because what you're going to realize is that after you have this surgery, when you turn left or turn right, it's going to feel like what's left of your insides is shifting whatever direction you are shifting in, and it is not a comfortable feeling. It feels weird. So this right here, even as you're getting up and down, definitely have that security to kind of stabilize you, because your abdominal muscles are not what they were before you had the surgery. So you definitely need some support there. And it also helps with the pain when you just kind of brace yourself when you're getting up and down. And this also has this serves as a dual purpose, because it's kind of already unzipped here, but you can actually put a heating pad or your ice pack in this, and you know, just kind of rest it on your belly if you're having some pain or discomfort there. So it serves as a dual purpose there. I'll just leave that, it's not zipping up. Another thing, again, just like I was talking about, I had company come over and I was wearing matching pajamas, but also when they would come over, they would obviously, most of them would visit me in the living room as I continued to progress. And so I would just have this, you know, covering my legs just to stay decent. Some of my friends are, you know, husband and wife, and you just want to be presentable for your company. Obviously, they know that you're going through something, but you still want to be as, for me, I wanted to be decent and as presentable as possible. So matching pajama sets and a blanket to cover my legs pretty much, you know, made me feel comfortable when people would come over. Alrighty. And then you get hot, get cold. It's something easy to just throw over you or just take it off of you depending on the temperature changes. Okay. These ice packs are a lifesaver, because you will be experiencing some pain and discomfort. It'll kind of help that pain subside when you put these ice packs on, and you can just wrap it in a towel and just lay it on your belly, just like so. And you'll feel that pain start to subside a little bit and give you a little bit more comfort. And you can also go from hot to cold, you know, just alternate until you're able to get some relief. Just be careful with the heat. You don't want to have too much heat. You don't want to, you know, sometimes when you have surgery, you're at risk for infection, and then with infection, fevers, and the last thing you want is to be having heat on you when you're having a fever or anything like that. So ice packs and this heating pad. All right. Pardon me. One of the things that I did experience when I was in the hospital, because I had a catheter in, when they took the catheter out, obviously they want you to go to the restroom on your own. And that was one of the issues that I had, because I was having trouble urinating. And when they took the catheter out, obviously, just like I said, you know, you're starting to use the restroom on your own at that point. And for whatever reason, I would feel like I would have to urinate, but it wouldn't come out. So thank God for the nurse that was there, because she recognized that I was having issues. And so she went and got this water bottle, put some warm water in it. And then she just kind of, not inside your lady part, but just like on the front part, she just sprayed some water down, there, and then it would just trickle down, and it created a sensation, and I was able to use the restroom. And this really helped when I got home as well, because I was still having issues urinating. And so just definitely a game changer here to create that sensation, and then the urine will eventually flow. So this was good. And if they don't have this at the hospital, you probably buy it at your dollar store, but if they have it at the hospital, you're paying for it, so you might as well take it home with you. So this is that. And also, you're going to be more than likely on pain medication. And a lot of those pain medications make you constipated. And you're going to need some assistance in using the restroom. Alrighty. So thank God for my aunt. She recommended this to my mom because I hadn't used the restroom. Oh my goodness. It was probably like a week, going on a week and a half. And so I started on this. It did not work immediately, but I kept taking it. And then eventually I was able to go. It didn't, I wasn't able to go normally, but it did give me some relief. So this got the party started, but this kept the party going. Alrighty. And you can use this in hot or cold drinks. Alrighty. Hot or cold drinks. So that was milk of magnesia and Miralax. These two things really help me go to the restroom. Okay. When it came to hygiene, I wasn't able to get in the shower as soon as I got home. And so my mom, she got this pail. Take this out. Got this pail, witch hazel, and I used Dr. Teal's, but it wasn't this scent, it was lavender. So this is what she would bathe me with. And because I couldn't get in and out of my shower yet, my tub is kind of high, what we did was, which served two purposes. As she went to the local drugstore and got this, okay, raised toilet seat. Hopefully you can see that, yeah, raised toilet seat. Alrighty. So serve two purposes, because now, again, just like I said, those abdominal muscles, those pains, that incision, it is hard. It is going to be difficult for you to ambulate. So having to go all the way down on a toilet seat and then trying to brace my hands on the wall just to get up, it's not a good feeling. So that raised toilet seat definitely helped out because it has the handles on there, and then I didn't have to squat down so far before my bottom hit that seat. So that was really good. And then also I was able to use it as a chair when my mom would take care of my hygiene and make sure that I was washed and cleaned. And so again, that definitely helped out a lot, and I'm thankful for that. Okay, because again, you won't be able to, just like I was showing you the milk of magnesia and the Miralax, you're already going to be having issues with your bowels because of the pain medication, and also you're not as mobile as you're accustomed to being. So your body is not functioning, your bodily functions are not doing what they normally would do. So with that being said, you have to be very cognizant and conscious about the things that you're eating while you are recovering, because you don't want anything else contributing to you being constipated. So I ate chicken noodle soup. This was my favorite during recovery, especially during those first few weeks. It was warm, didn't cause any gas, didn't contribute to add anything to constipation or anything like that. So I really enjoyed just eating chicken noodle soup. And also drinking tea. This is caffeine-free chamomile tea. And I would use the Miralax in this tea. And just like I said, you can use it in cold drinks as well, whatever your preference is. Just follow the directions on the bottle and you should be fine. Just like I said, you might experience some gas. And the last thing you want is to have gas and you're not able to move around to as much as you want to kind of move that gas out of you. But if you do experience having gas, you can drink ginger ale, Sprite, drinks like that, but you don't want that to be your main main drink. You definitely want to drink a lot of water. Just like I mentioned earlier, I had a catheter in, and so with that being in, there is a higher risk of you getting a UTI, urinary tract infection. So again, make sure that you have some water by your bedside. you may not want to, I know you probably like, I don't want to drink a lot of water because I don't want to have to get up and down to use the restroom, but it is going to do you some good to make sure that you are drinking water, because you need to flush your system out and make sure that you don't have any further issues with that. Also, snacks. This is not the snack that I had during recovery, but just brought it for the sake of the video. But you just want some pleasure, you know, some satisfaction, you know, while you're going through this. But obviously you don't want to tank up on a bunch of snacks, because again, your bowels are not moving how they normally would because of everything that's going on with your body. So, but you do need some pleasure in there, little sweets here and there, whatever your snack may be. So that's important. And also, before I had the surgery, I ordered 2 recliners on Amazon, and they turned out to be pretty nice, because I didn't have this furniture at the time. This furniture reclines, but the furniture I had when I had the surgery, it didn't recline. So I ordered 2 power recliners. My mom put one in my room, and then also one in the living room. So when I would have guests, I would just sit in the recliner. And you definitely don't want to have manual recliners, because you don't want to be pulling and tugging. None of that. Don't overexert yourself. Don't lift anything heavy. You know, you don't really want to be pulling and tugging on anything, because there's an increased chance that you can get a hernia, and you definitely don't want to have issues on top of, you know, what you've already gone through. So definitely don't want that. So be very careful, very, 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 very careful, and let your caretaker do what they are there to do, and that is to take care of you. The recliners worked out great. Sometimes I would have to sleep in the recliner because the bed would be uncomfortable, but I would just use that recliner to sleep in, to sit in, and I couldn't move around a whole lot, so I would just ball my fists and basically push my body up like that and move around from left to right or whatever I needed to do. And I also experienced a lot of butt pain, because your nerves are just trying to figure out what's going on and trying to heal themselves and redirect themselves. So I had leg pain and butt pain, but you know, eventually those things subsided weeks later. I'll say probably a month and a half, 2 months later, before I felt some relief in that. And sometimes I do still have that same sensation in my legs, and it's not comfortable, but it is bearable. Another thing, popsicles. Hold on. Sorry, I had to take a quick break, but I think that is just about the gist of all of the items that I wanted to share with you. A couple of tips that I do have for you. Just like I said in the beginning of the video, if you don't do any of this, or you don't feel that this is useful or helpful to you, I do want you to know that you must have a caretaker. And with that being said, it is important that you also are considerate of your caretaker, that you take care of your caretaker. So one of the things that I can suggest is, before you have the surgery, make sure that they have the things that they need in order to be comfortable, especially if they're going to be staying with you during that time. You know, water, I don't know, whatever it is that can make their time taking care of you easier on them as well, because you know, this thing is going to work both ways. You definitely don't want to burn your caretaker out. And again, you just want to be considerate of them. And so the second thing with that is, make sure that you're following your post-operative instructions, because the last thing that you want to do is burden your caretaker down with issues that that are self-inflicted because you didn't do what you were supposed to do. So obviously, not supposed to be lifting anything heavy. Get lots of rest, drink water, take your medicine how you need to take it, and just do the things that they tell you that you can do, and don't do the things that they tell you that you cannot do. Because again, you want to be considerate of your caretaker, and make sure you take care of them as well, so that they can do their best to help you get back to full recovery. So I just wanted to share those tips with you. And then also, There's going to be some downtime. You know, my downtime, they tell you 6 to 8 weeks. I had some other things that came up during my recovery process, but I'll share that with you in another video. But I do want you to know that there might be some things that you are intending to do during that downtime that you may not be able to do. And the reason why I'm saying that is because I experienced a lot of fogginess, and I was not able to concentrate how I'm normally able to focus on things. But just don't be too hard on yourself if you don't get those things done, if you don't accomplish some things that you set out to do during that downtime, because the most important thing is that you get rest and that you recover. That's going to be one of the #1 things that's going to contribute to you having a successful recovery is rest. So get the rest that you need. Don't feel guilty about getting that rest because it is needed. All right. So, but when you do have those times where you are able to lend yourself to some of the things that, you know, bring you some sense of calmness and peace and joy and all that other stuff, then introduce those things into your recovery process. Just don't try to overexert yourself. And just like I said, one of the things that I set out to do, I was like, okay, I'm going to read my Bible during that time and all that stuff. But I just was foggy and I just didn't have a lot of time to focus, or not, I won't say a lot of time, but I just found myself not being able to concentrate and focus on the things that I thought I would be. So what I would do, I would just try to pick up my word and allow the Lord to lead and guide me to certain scriptures and just minister to me, because there's some things that I was experiencing emotionally that I had not accounted for prior to having the surgery. I was already having some trepidation about some of the you know, leading up to the surgery, and then post-surgery there were some things that came up that I wasn't anticipating, but nevertheless it was there. But I just really yielded myself to the Spirit of the living God and just allowed him to minister to me and to, you know, just kind of heal some things that were going on. And that was a process within itself. And so the times where I was able to pick up the word, I would just yield myself to the Lord, and whatever he ministered to me in those 1 or 2 scriptures that I was able to read, you know, that was enough. It sustained me for that time period. So you will have a lot of downtime. So if you want to find some things that you like to do, then definitely do that. And that, if that'll calm you down and kind of ease you back into, again, some sense of normalcy, then definitely introduce that into your recovery process. I just want to say, praying for you. I'm not sure the circumstances in which you are having the surgery, but I do know that this is a major surgery. This is not like getting a wisdom tooth pulled out. It is serious, and it is quite a transition for any woman that goes through this. So I want to let you know that you are not alone. I am praying for you. I may never meet you, never lay eyes on you, you know, but if you're watching this video, just know that there's somebody out there praying for you, that's concerned about you, that cares for you, and I love you. And from woman to woman, you will come through this. Hormones, you know, might be doing some wonky things, but it's all a part of the process. And just know that you're going to come through this. You will come through this. And one last thing. Sorry, I think I said that twice, but I'm recording on my phone, so I'm just going to pick this up. This is just a portable phone charger, but I wanted to share with you, if you can, keep your visits and your phone conversations to a minimum, because those things wear you out. It may not feel like it, but you know, while you're having those conversations, or while you're entertaining, or you know, you have company over, once those visits are done, or once you finish that phone conversation, a lot of times you're going to be exhausted. And this is something that my mom told me even before I had the surgery. So she was in charge of my phone. So if someone texted or called and just were looking for an update, then she handled that. And if I did have phone conversations, they were kept to a minimum, except for one time when I was talking to my dad and we were laughing and joking, and but I paid for it after I hung up the phone, because just like my mom said, it wore me out. So if you can, just keep those things to a minimum. Again, I love you to life. You're going to get through this. It is a difficult thing for many people, and but it's nothing that is going to overtake you. It won't overtake you. We're not going to let it, because we're going to be praying, and I'm going to be believing God on your behalf. And I hope that this video blessed you. I'm going to try to do 2 more videos to tell you about some of the complications that I experienced, some of the things that I was not expecting after the surgery, so that you'll be prepared for that, and you know, you don't have to be afraid, and you'll know that maybe these will be some of the things that you may or may not experience. And then also, I think the last part of this series, try to do it in 3 videos, will be my testimony, to let you know how I came to this point to end up having the surgery, and share a little bit about this, you know, just my testimony and about the process. And yeah, and so I'm hoping that you'll be blessed. Love you to life, praying for you, and I look forward to you having a successful recovery. God bless you.